Developmental surveillance is important for early detection of developmental delays and disability. A case of an 18-month-old female was brought to your clinic for a well-child consult. So what are the steps for developmental surveillance? Developmental surveillance is number 1, asking the patients about their concerns, taking a developmental history, observing the child, identifying strengths and risks, documenting the results, and communicating with others. By asking about parents' concern, the pediatric healthcare professional can elicit important information about the child's development, learning, or behavior. Discussions with the family should be documented in the medical record. The absence of parental concern does not preclude the possibility of serious developmental delays. A developmental history is a vital component of any history taken during a health supervision visit. The pediatric healthcare professional may identify delays or other abnormalities in a child's development that warrant further investigation. Asking questions regarding the milestone she has achieved and help the patient track down each milestone by providing links or sources. The developmental milestones for 18 months are keeps downstairs, makes 4 feet down, removes garment, points 3 body parts, uses 10 to 25 words, begins to show shame. The red flags are lack of simple pretend play, inability to walk independently, does not follow simple commands, and inability to point 2 body parts. Observing the child is to be able to form accurate and informed decisions in terms of the communication, movement, and the interactions of the child. Limited evidence suggests observation of the parent-child interaction may also aid in identifying children with delayed development. Next step is identifying the strengths, risks, and protective factors. Risk assessment is an important part of developmental surveillance as it identifies underlying factors that could impact a child's development. It is important to ask the parent's family support, family history, medical history of the child, and the mental status. The next step is documenting the results. Medical records should be documented at all times during well-child consults, surveillance, and screening activities. It must also contain a table in where date of administration, dawn, and results of developmental surveillance in terms of child's age. Last step is communicating with others. A wide range of professionals may be engaged with the young and developing child. This includes child care providers, home visitors, preschool teachers, and developmental therapists. Communication between members of the medical home staff and professionals on the child's development is therefore a critical part of surveillance to ensure optimal care and coordination of efforts and activities to optimize the child's development. Here are some screening assessment tools used on an 18-month-old child. A properly done surveillance with screening is vital in identifying problems. Thank you for listening.